So welcome everybody to this first monthly chat of the Panelfit project. We will have every month a different subject and different expert chatting with us about it. This month we'll talk to Iñigo De Miguel, lawyer and bioethicist and research professor at the University of the Basque Country and project coordinator, which is project coordinator of the Panelfit project. The topic of this first meeting is digital pills. So opportunities and pitfalls from the point of view of data protection, privacy, ethical and legal issues connected to these new technological devices. I will thank you all for muting your microphones. You are free to type questions in the chat, and we'll save some minutes at the end to answer to a couple of them. This meeting will be is being recorded and will be available online. We will let you know how to listen to it or download it later. So will be all the chats of this series, let's say. Okay. So good morning, Iñigo. Let's start with the first question is twofold. Let's say first I'd ask you as a coordinator of the project to give us a brief introduction of the Panelfit project, and then to introduce this topic. So what are digital pills?
Well, thank you so much, Federico. Thank you everyone for attending this chat. I hope that this will be interesting to you. I will start with introducing the project just in a nutshell. Panelfit project is an 2020 funded project, so it's funded by the EU Commission, and it's part of the Science with and for Society program. So more or less, we could say that the objective of this project is to try to soften, to make it easier for researchers to get adapted to the new regulation regarding data, but also trying to help them to put in practice some specific guidelines on how to do things quite well in terms of data protection and informed consent and so on. So that's the point. But we are also trying to be quite critical in our analysis of the EU regulation, and that's why we're just trying to focus on some very interesting new topics that have to do with data sharing, such as, for instance, digital pills. Okay, so that's more or less what we are doing in Panelfit, and one of the activities that we will be developing is these monthly chats that are supposed to be kind of dissemination thing, and we will have an expert talking about different topics each and every month. So that's what I can say for this very moment. And regarding to the specific topic that we are addressing today, digital pills. Well, this is quite a very innovative technology that is quite easy to describe, quite difficult to address. Digital pills are just kind of parts of sector of digital health that is based on an innovative technology. The key point is the development of a kind of a microsensor that's most well known is the Proteus sensor that can be embedded into a pill, into a drug, and introduced in a human body. So when you ingest the pill, and the pill gets in touch with your fluids in your stomach, it sends some kind of a signal that it's received by a patch that's usually in your arm or anything like that. It could also be recorded by an app in your iPhone, and then they could send the information to someone else, such as, for example, your physician, a doctor, the healthcare system, or whoever you want to or you authorize to. That's more or less what a digital pill is. Okay.
Okay. Very, very clear. And thank you. Why are digital pills an opportunity for patients and for healthcare systems?
Well, it's a little bit difficult to say this in a few words, but I will try to. So let's divide the perspectives. For the patients, why they could be a good thing? Well, first of all, think about all those people who really suffer because they are never sure on whether they are taking their pills or not. Well, for these people, this could be a very good idea because that they will offer a kind of a recording of what's going on with the doses and whether they are taking the pills or not. So they will be much more relaxed. For there's also another type of people that could be very interested in this kind of fields. And here we just mix the public interest and the private interest. Think, for example, about people who are suffering some kind of mental disease or whatever that could make them a little bit dangerous for the rest of the people. In this case, we often opt for forcible confinement. This means that those people will be put aside and enclosed somewhere to make sure that they are taking their pills or they are not dangerous for the rest of the people. Okay, so usually we take this measure because we are not sure that they are really following the treatment. Okay, so this could be an alternative. We could tell them, well, if you accept to take these pills, there will not be possible consumption, so there will be a very nice option for them. Okay. Also happens with some kind of contagious diseases, such as, for example, tuberculosis. That this could make it easier for public authorities to make sure that they are following the treatment and they are not dangerous for the rest of society in that sense. So there's a question of public interest in there. But I think that the most important thing and most attractive, but also the most dangerous part of that, is that the healthcare systems and the healthcare providers will be much interested in knowing about the real adherence to treatment. And this digital field offers a splendid possibility for doctors to know whether the patients are really taking the pill or not. That's a kind of definitive answer to a very typical question that is in most physicians' mind, which is this treatment that's not working well, or is it the patient that is not well taking the pill and so he's lying to me and it's not showing that he's doing so? So that's the interest in that.
Okay, so yeah, up until now we are listing a lot of pros, a lot of promising, let's say, elements of these devices. But what I see here are also some troubles in terms of informed consent and freedom of choice for the patients. So let's see the first one. So do you think digital pills involve special issues in terms of informed consent?
Yeah, indeed. They involve lots of very, very important issues. First of all, because they really include lots of different consents in a one only activity. First of all, you get a kind of medical treatment, and so you get to give your consent to this medical treatment. But when you're consenting to this kind of medical treatment, and it includes a kind of digital pill, so if you really need to, if you want to go on with that, you should also consent on the use of this device. And this usually implies that your data being gathered and probably shared. So you also need to give a kind of consent for data processing. And furthermore, lots of these kind of devices and applications and software involve some kind of user agreements in them. So you also need to give your consent to them. So all of these different type of consents are, must be put all together. I wouldn't even talk about informed consent in all of them, because you could talk about different ways of legitimacy depending on the activity that it's or the part of the activity you are facing at any point. So this scenario is really very, very complex.
Yeah, I think maybe someone should design tailored consent for these devices, because it's something quite different from other situations in which you have to express your consent, but to a lot of different things in once. So it's there are possibilities that the patient is a bit confused on what is exactly consenting to. Yeah. Yeah, and from the second issues that I mentioned before is about freedom of choice. Let's say that companies or governments start to push patients to choose such treatments to the detriment of other treatments. For example, making them tax exempt while other treatments are not. I think this is an issue for the freedom of choice of the patients. What do you think?
Yeah. Indeed, it makes them an impressive issue to the idea of informed consent, in the sense that usually we consider that it's patients who decide what the treatment that they are taking. But in any case, we must keep in mind that usually most of the governments that I know, most of the healthcare systems don't let you make a decision on the concrete brand, for example, of pill or what kind of extra product you are willing to take. I mean, they don't fund everything. So I don't think it is disturbing that they are just saying, no, we will not be affording all type of drugs. We prefer this kind of ones. The main problem is that we must distinguish between drugs and the devices. The main problem that we have at this present moment is that there are only a few number of drugs that will combine with this kind of devices. This means that, for example, a public system could say, well, we've got this only drug that is treating this kind of mental illness, and we want you to take that. And this will be very unfair, because, I don't think that we could force patients to choose when they, or to be forced if they have no election. I mean, I would consider that somehow public interest could make it interesting to say patients, no, maybe you should take this kind of sensor if you want me to pay for that, because adherence is very important. But then you should offer them a lot of possibilities of different drugs, because, for example, side effects of one drug could be very important for one concrete patient, but there could be another drugs that are more or less similar and don't really create this kind of side effect. So it would be extremely unfair to force a patient to take the first one, or to tell him no, or tell, if you don't take this one, I will not fund it, because there's no real alternative that is not causing that effect. So I don't really think that in any case public interest could be strong enough to override the kind of beneficence principle.
Okay. Yeah, that's quite fair to put the patients always on the first place, let's say, in terms of health treatment. The other big issue about such products, since they involve a transmission of health data of person and of personal data of the patient, is about data protection and let's say the subjects involved in the transmissions of data. So let's first start with a more general question. Let's say, do digital pills raise worries similar, that are somehow different from other products and services that imply a huge amounts of personal data? Do you see some special issue here other than other products?
Well, one of the things that we have that makes it different is that they are usually embedded in a drug. So first of all, this makes a lot of things. They are not just a kind of, like the typical sensor that you're wearing in your body and shows the doctor whether you are taking a walk or not. So it's quite different because it's linked to a drug. So it's a little bit more different. In some other things, it's got a lot of things in common with digital health devices and everything that is providing data to your healthcare system or whatever. And of course, they all have the same kind of issues. And one of them is, for example, who is receiving this information. We should also keep in mind that usually this kind of pills or digital pills could be especially interesting for people who are suffering from chronic diseases. So usually those are also the type of people who depend on caregivers or who have a family that will be always interested in knowing about the real thing that is happening with you, if you are really adhering to your treatment or not. So there could be an additional pressure on the patients due to the special nature of the type of the diseases that are linked to digital pills and so on. I think, yeah, there are some specificalities. Sorry, I don't know exactly about the English word, about these specificities, I think, about this kind of technology, indeed, yeah.
Okay, and what other personal data could be collected beyond what is declared, let's say, on the information leaflet? Because you said that there is the drug, there is the devices, so there are the health data and the personal data of the about the user, let's say the patient user. So when did it take the pill, where it was?
Yeah, I understand the question. So the point is that a sensor could really gather a lot of different information about what you are doing, what's going on with you. The point is that, well, in principle, when you sign this kind of user agreement or informed consent or whatever, you should be aware of all the data that is being taken from you and all the users that this data will be given. So the point is that, of course, you need to be aware and you need to be informed about all of that. And if this is not really done, then you will be out of the law. I mean, you will be doing something clearly illegal. Okay, but of course, it doesn't guarantee that this will not happen. I just tell you that this will be illegal.
Okay, so a related question to this is what are the risks of a data breach in this field, and is it possible? And another way of seeing the question is it possible that companies that rely highly on user profiling, like Facebook or Google, have access to such data, even if all rules and regulations are respected?
Well, I think, two different things. Well, there could be data breaches. Yeah, of course, in everything in this world could be. But the companies should report this as soon as possible. Okay, so patients should be aware that this just happened. Regarding the possibility to share this kind of personal data with these companies, I think that if patients are giving consent, that could be doable. But the question is from the very beginning, why should these companies have access to this kind of data? I mean, why? If this were the case, we should inform patients very, very well. But I'm not really, I don't think that this kind of companies will be the most, or are the most dangerous kind of companies. I think it's much more dangerous for patients. So for example, some kind of insurance companies, you know, those are the ones that really are so much interested in knowing about data related to your health. Okay, so, and sometimes it happens, you know, that especially some private companies, there are few groups that are not only built on the healthcare, hospitals, or so on institutions, but also composed by insurance companies, and it's very, very, very important to fix that they will not share the data between all of them, even if they belong to the same kind of people. I mean, if they are the same company, okay? But it's just very, very hard to do, I guess.
Yeah, maybe the same we can say about banks that can have to decide if to give a mortgage or not to a person. Maybe they could be interested in what happens with your health.
Very interesting. Yep. Yeah.
Okay. And What about pharma industry and the patents?
Oh,
Do digital
that's
pills introduce any novelty?
yeah, that's also a very interesting part of this issue due to a very simple, understandable thing. Well, you know that usually products are protected by patents for a time. It's not forever. Usually, it's like about 20 years or anything like that. So most of the pharma companies are always willing to make their patents last a little bit longer, but it's not so easy to do. They really need to introduce a kind of novelty in their product. Also, in these terms, this new technology is an excellent opportunity because they could always try to introduce the sensor in a quite old drug and try to patent a new product that indeed will be a new one. And then they could have a kind of new patent for a long time, making this kind of product that is quite obsolete a kind of a novelty with a new patent. And furthermore, that could provide them with new and very interesting combinations because, for example, you could make use of an old drug with the new sensor and build a very new product and reserve your maybe more effective drug uh, to some other users, and then you will have two products, very very competitive in the markets instead of only one. So in that sense, it is very very attractive to pharma companies. But this could be a kind of, I would say, not so good way of doing in terms of the patient's interest, I think.
Okay. And okay, we are going to the end, towards the end of this first chat. So I will invite once again our audience to type some questions in the text chat we have here, if they
May I
want.
ask,
So
Federico, sorry, before giving, may I ask something that maybe I didn't clarify so well, but I think it makes sense. It's very important.
mhm.
Okay, just a last point. I think
No,
it would
I
be
had a last question
okay,
before saying
okay,
goodbye. So I
okay.
don't know if it's the same that you were going to,
I
but
don't.
it's about the legal framework. So if you see urgent flaws to be addressed in the current European ethical and legal framework about digital pills, and if Panelfit has in mind to push for such changes or improvements on the subject.
Well, I think, well, no, what I had in mind was not the same, but I will be glad to answer to this. I don't think that the EU framework at its present moment is so well designed to deal with anything like this because this is very complex. This is very new and involves very different things altogether. And usually the data protection regulation is thought about data processing as such, but there's a totally different way of regulating a kind of informed consent in terms of treatment, medical treatment, and so on. And we have to mix both of these kind of things. So we need to start thinking about how to conciliate everything that is involved in there. We also have to clarify, for example, the real scope of the public interest exception. I mean, to the legitimacy by public interest, for example, and so on. So there are a lot of things that we need to clarify in terms of the EU regulation of something like digital pills. And of course, in Panelfit, we will try to deal with that, okay? And then if you just let me give that only point, that it's quite related. One of the things that we have in there, it's not really a legal or an ethical issue. It's a little bit more about the kind of the sociological, maybe the organizational issue, is that uh, until this moment, we try to place the issues related to adherence through a quite traditional tool that is the confidence, the trust between physicians and patients. Okay, we tried that the patients see doctors or someone who is on their side, and patients are able to convince doctors why they are not taking the pill, why the other treatment is not so well, because it could happen, for example, due to side effects or whatever else, but they don't it's hard for them sometimes to tell this. The main problem is that if we start introducing this kind of devices, it's like telling to patients, sorry, we don't really trust you. We don't think that you are telling us the truth. That's why we're doing this to you. And I think this really complicates the things in the sense that maybe we will win a battle against adherence or lack of adherence, but yet we will be losing a very important thing, that is the relationship based on trust and confidence between patients and doctors. So that was the only point that I wanted to make it, but I think it's a very important point.
Yeah, it's very important, and of course, in this short chat, we couldn't address all the aspects of such a complex device and an issue.
Yes.
And of course, that the last point you mentioned is very, I think, connected also to the sense of surveillance that a patient can experience once he has something in his body sending signals to devices that are read by other people, including physicians and or relatives, familiar. So yeah, it's another very interesting issue. But I mean, I think that these chats are a way to start a discussion about topics, not to be exhaustive, of course.
Okay.
And so I think we can say that this first experience was quite interesting. We had some audience following. I don't see any questions in our chat, so yeah, our audience.
So we made it all very clear. I mean, very convincing in that so many states. Or maybe not. Maybe it was the opposite, and that's why nobody's making questions. Who knows?
I see that someone from your university is willing to write a question. Maybe, I don't know if you want to wait for him to write, or maybe he can just send us his question. Oh, okay. Here we are with a question.
Okay.
I'm reading it in real time. So, regarding digital pills, a 2017 New York Times article included the opinion of Glenn Cohen, a Harvard Law professor, who said, safeguards adopted include allowing patients to instantly stop physicians and others from seeing some or all of their data. Although the concern for data protection seems clear in practice, do you think that it will be possible to respect the will of patients by achieving effective data protection in relation to this technology, thus avoiding the so-called biomedical big brother?
Well, so difficult to answer this question because it brings you into a very different terrain. That is whether the laws will be respected in practice or not. I know about the Glenn Cohen's opinion. Indeed, he wrote a very interesting paper all together with Timo Mintzen and someone else. I don't remember all the names. And I think Glenn Cohen it's made up very good points on this. I think that indeed patients should be given this kind of right. Indeed, they got it. And also they've got the right to withdraw consent, okay, to data processing. But what does it mean in practice? This is much difficult to know, okay? Because, for example, well, imagine that they are just withdrawing the consent to data processing, but the public system, the healthcare institution is already, starting to give him a kind of advice or her a kind of advice saying, sorry, we have detected that you are not following your treatment, so we will not really fund this this treatment anymore. So how can we stop anything like that? I mean, would this kind of withdrawal mean that no consequences could be taken on this basis and so on? That's something that we should analyze. And further on, there's a kind of, the unconscious knowledge. If a doctor knows that a patient was not taking the pills, you could withdraw consent. And even you could think that you could delete all data, but the physician knows. And how do you manage to delete them from his or her memory? This is very difficult. And we are talking about a relationship that is based on something like confidence and trust and the capability to believe a patient. If you know that this has happened, it's very difficult to delay that for the unconscious of a doctor. Maybe the patient change the doctor, but this will involve a changement that could not be so good for his or her interest. So very difficult issues, yes, at the stake in that part.